Kyle Mack here at MedPsych Health, and today I'm sitting here with Dr. Hanna, and this is again a response video to the coronavirus and just some of our reflections that we've had about all of the cultural shifting and what's going on and changes that we've seen. So really what we want to talk about today is how our culture has responded to this false sense of control that they thought they had that has now been taken from them. So we really just want to start there and talk about the idea of control. What does it mean for us as human beings? What does it mean for our culture? And even the United States in this specific area, what that looks like for our society. So Dr. Hanna, why don't you start us off and just share a little bit about why do we feel like we have this deep need for controlling our environments?
Well, I think the reason is because deep down we know we're not in control. And we don't like that.
No. Not at all.
The interesting thing is, and I find this with myself, that we try to make good decisions. We try to do the right thing, live in the right neighborhood, send our kids to the right school, drive the right kind of car, have the best health insurance or the best technology and gadgets. And it's all to insulate ourselves from a world that is not safe. So prior to even this whole coronavirus thing, we know by instinct that there's a lot of danger out there. There's much anxiety, and there was much anxiety before this ever happened. Right? Before coronavirus, there was already a lot of anxiety. And a lot of the anxiety is driven by the reality of we live in a world that is unpredictable. We live in a world where things happen that we don't like, and things happen that we do not want, and things happen that are not good. There's bad outcomes. We know there's bad outcomes. We've always known that people close to us can pass away at any moment, that people get into accidents, our kids struggle, and so on and so forth. And by instinct, we don't know what to do with that. So we become fearful, right, and we worry. And we know we're not in control, but we're desperate to exert control over our lives, which then feeds this anxiety.
So it's interesting that you say we know, and I agree. But I think for a lot of people out there, this idea that Dr. Hanna's putting forward or putting out there to you is that you're not in control. And that's really hard to stomach. It's really hard to hear that, take that in, and agree to it. And I think it's only when we have events like this, like a crisis of some sort, that we realize that the foundation of our lives is actually uprooted. It's ripped out. And I think of like the stock market crash. I think of, other epidemics that we've seen, even if it's regional or local. I'm thinking even back to, swine flu and some other things. There's been similar responses. Now, this is a very unique and different virus, but I still think that it's interesting how in those moments, people have to look at the foundation of their lives.
Yeah. And this happens with so many other things, right? This is just revealing this to be for our entire country and probably the entire world, right? Where we are all fearful, right? The World Health Organization saying yesterday there's a global pandemic is like, whoa, this is serious. Last night, the NBA, the National Basketball Association, suspended all their games. They're like, whoa, this is serious. This is a big deal. And it is a big deal. And then we need to examine our hearts. We need to do some self-reflection of really recognizing, where do we go? What do we do with that? We're so desperate to control. And the control, a lot of it is all about preventing a bad outcome to myself and my loved ones.
Yeah.
Right? I don't want anything bad to happen. Normal, appropriate. It just, the line gets crossed into excessive fear and panic and anxiety, which then reveals what's our foundation.
Right. So let's talk about that, because there's wisdom, and then there's fear or fear mongering, or this idea of hopelessness that we see, with our patient population. And there's definitely a line that's crossed. So when we think about that line, like I think about going to the supermarket and seeing shelves just
Mm-hmm.
vacated of food, everything, and I'm sitting there saying like, really, this is like Hurricane Katrina, Irene,
Sandy.
Sandy level.
Yeah.
That's what I meant to say. Level responses. Like I walked in and I just walked right back out of the supermarket because I saw no food. I was like, you guys wiped everything out, and I say, you guys, I would probably do the same thing, to a degree. So that's where there is a line, but at what point is that just hoarding food and resources, trying to build up my little kingdom and keep myself safe at the detriment of others?
Yeah. Wow. That's a big one right there, right? Our instinct as part of our control is my kingdom, and I think that's a good way of saying it. And that's hard maybe to hear, that our selfish nature kicks in, where we are no longer thinking of others,
Hmm.
where our instinct, right, our by nature is me, myself, and I, and my people, and my family, and my kids. And that reveals that, right? Crises reveal our true nature,
Yeah.
that we are selfish by nature. That's our instinct, is to hoard, is to protect our own, and saying, yeah, I don't want to think about the other person. That's not right now. I just need to focus on my family. And wow, that's pretty sobering to realize. And
Yeah.
and one of the things that, and I would say this again to myself, is let's look at this crisis as an opportunity,
Hmm.
as an opportunity as a culture and as a country to do some deeper thinking
Yeah.
about what matters and who we are as a people, and who am I, and why is my nature is to hoard and to be selfish. You want to be wise and you want to take care of your family. I'm not saying that's wrong,
Yeah.
but we need to examine our heart and truly, genuinely, each of us look at, why do we do what we do? Why is it that we do that? And that's our default, is to think of me first.
And one of the things that comes up for me when we talk about like the idea of selfishness and protecting yourself, ready? Let's take the coronavirus and this pandemic that we're now calling it. If we really look at the idea of, well, I'm only going to protect myself, what does that look like? My family of four
Mm-hmm.
buys out 20 cases of hand sanitizer, right? Well, now my family has hoarded a resource
Mm-hmm.
that is a scarcity, that is now not accessible to many, and there's a cost and a consequence to that action, that behavior, that grasping for control. So now let's say Dr. Hanna's family is sitting there trying to find hand sanitizer.
We don't have any, by the way, in case you're
And
wondering.
yeah, don't no,
No hand sanitizer at home.
nor do I, nor do I.
Yeah.
But now Dr. Hanna's family cannot gain access to that hand sanitizer, to that resource that's scarce. Now that's a problem. Now his family is now less protected than my family is because of my selfishness. Now here's the trouble. When we talk about this specific type of, virus, pandemic, how it's spread, transmission, all that, I've actually just not only hurt his family directly, but I may have indirectly hurt many other people
Mm-hmm.
who then are not as safe, not as
Right.
protected. So if my one family's actions affect 10 families, that may be 10 families that are potential carriers. Maybe they don't get sick, but then they can then pass on the coronavirus to somebody else. And now that's just, you can see how that snowballs. You can see how that gets out of control. And I think it's important to look at when we talk about this idea of control,
Mm-hmm.
that oftentimes the more we try to control something, it actually hurts
Yeah.
those around us and ourselves in the long run, which is hard because in the moment it feels like this is what's producing safety. This is
Yeah.
what's generating comfort.
Mm-hmm.
But there's a cost.
Yeah. And it is, and it's that desperate need for safety, and we've always had a false sense of safety.
Mm-hmm.
Again, if you live in certain neighborhoods and drive a certain car, or so on and so forth, we are all about safety. Nothing wrong with wanting your family to be safe. I think it's normal, it's appropriate. It's wise. Um, but when we start obsessing and ruminating and trying so desperately to prevent, we actually crush.
Mm.
And the other thing is, it crushes our soul. Our souls shrivel because we become so self-focused to our detriment, and that actually breeds more anxiety.
Mm.
When we become so self-focused and so self-consumed with our needs and our sense of controlling our world, it crushes us, because we are whenever we're self-focused and self-absorbed, that breeds more anxiety, ironically.
Yeah.
It doesn't breed more comfort at all.
And the reality we have to face is that that control rarely, if ever, is effective.
No.
And I say that as a therapist. Dr. Hanna's agreeing with me as a psychiatrist. The simple fact is that if this were super effective, we probably wouldn't be doing a video, we wouldn't be talking about this.
Yeah.
But the very fact that the more we try to control things, the more consequences, the less effective that is in the world around us. So can you give us a few examples, Dr. Hanna, of why that's not effective? So we kind of just toyed with the idea of the coronavirus and how that may cause further spread because of my own selfishness. But what about when we bring it back to mental health, when we bring it back to anxiety?
For example, it's not uncommon that people who are anxious try to control those around them. And it destroys the relationship. Mm-hmm. They're afraid that something bad's going to happen to somebody. And I could say this maybe as a parent, for an example. I become so fearful that something bad's going to happen to my kids, so I try to control them, and that I don't want them doing this or doing that or doing this. And what am I actually doing is I'm crushing them. I'm limiting them. I'm limiting their ability to navigate this world and limiting their ability to be able to be independent.
Yep.
But because of my seeming sense, well, I'm just protecting them. I want them to be safe. I don't want anything bad to happen. Right? And again, we can do this with any relationship, but anxiety convinces us, avoid, don't do things that could potentially be harmful. So we try to avoid and want people around us to avoid, and what we're actually doing is crushing them. And that's just kind of a basic example, is how anxiety leads to avoidance, and then we try to control those around us to prevent something bad from happening. I think at its core, so much of it stems from we don't want anything bad. We don't want a bad outcome because we genuinely believe we can't handle it. We can't handle if there's a bad outcome. And the problem is we live in a world of bad outcomes.
Yep. And that's the simple truth, right?
Yeah.
So we may be insulated to a degree for all the reasons that you just mentioned. Maybe it's where you live, access to health care, resources at your disposal. And I've heard a lot of these things from my patients that are saying, if something were to happen, if I were to get it, if my family were to get it, I think I can manage that. I said, what do you mean? And they're like, well, I can afford the best doctors and I can, do all these things. And maybe for coronavirus, there is some truth to that.
Yeah.
But then we talk about car accidents. We talk about just all of the random possibilities of things that can happen, that happen every day, right? We were talking about it before, divorce, car accidents, I don't know, speeding tickets, There are things that are out of our control that have consequences that we can't account for, we can't predict, and we can't always prevent, no matter how hard you try to insure against it. And that's hard.
Yeah.
It's really hard to...
And each of us puts our hope in something or someone to help us to make sense of all this.
Yeah.
And that's always the big question, is what are you putting your hope in? And is what you're putting your hope in helping you in this moment?
Yep.
So,
yeah.
Hope that's helpful.
Yeah. So stay tuned.
Yeah.
And we will be talking a lot more about control in the future, I'm sure. But this is definitely a good time to start talking about it, because we need to, think more broadly and think deeply about this issue. Maybe relinquish the reins a little bit. And hopefully act a little bit less selfish.
Yep.
So,
all right.
Thank you. Subscribe below, and we'll talk to you later.